Now, the South African National Blood Service is calling on recovered COVID-19 infected patients to donate plasma. The SANBS is exploring ways to use blood plasma for the treatment of COVID-19 patients locally. It follows the approval by the Human Research Ethics Committee. The SANBS will be starting phase 2 of clinical trials on plasma donated by recovered patients for national clinic trials to test the safety and effectiveness of convalescent plasma. Joining us now to tell us more about this procedure is transfusion medical specialist at the Western Cape Blood Service, Dr. Caroline Hilton. Hello and welcome to Radio 786, Dr. Hilton.
Hi, thanks so much for having me. An opportunity to explain the trial.
It's good to speak to you. So we've seen that these tests and trials were taking place internationally as well, and some people having recovered from it as well. So in terms of South Africa and the SANBS's role in participating in this, so what exactly will be your role?
Okay, so just to clarify, I'm actually part of the Western Cape Blood Service. So there are two different blood services in South Africa, the South African National Blood Service and the Western Cape Blood Service, but we're working together for the purposes of this trial. And essentially what we're doing is we're looking to recruit people who have recovered from COVID-19 infection, but these people must have been at least 28 days symptom-free and meet certain inclusion criteria. One of them being we need to use either male donors or women who have never been pregnant. And the reason for that is that this group have lower antibody profiles that could affect the patient receiving the plasma product. And so very basically what this trial involves is to take plasma from people who've recovered from COVID, and the plasma contains antibodies towards the infection. And then there will be a clinical trial running in several hospitals or multiple hospitals throughout the country where the plasma containing the antibodies is transfused to patients with COVID-19 infection to see if this will assist their recovery.
So how will the process then take place? Will it be the same as donating blood?
It's similar, but it's a little bit more complicated. So we are receiving donors' names either through the National Institute of Communicable Disease or people can also register on the SANBS website. And what it is, if you come in, we've got one site here in Cape Town, but then multiple throughout the country. You'll come into our site, have a needle inserted into your arm. This is provided that you meet all the criteria. And we take the blood out. It gets taken up into a machine called an apheresis machine. It gets spun, and we just take out the plasma and then, well, some of the donor's plasma, and then we return the red cells and the rest of the plasma back to them. So it probably takes about 45 minutes in total, and it's not too bad. There aren't many things that can go wrong. It should be tolerated by most people.
In terms of the plasma, though, is there a window period for how effective it will be after its extraction or that when it's taken from the blood?
So we can actually take the plasma and freeze it.
Okay.
What we will do in our situation, we'll take 1 unit of plasma from somebody and hopefully be able to divide it into 3 doses. Then we do something called pathogen reduction to reduce the risk of transmitting any type of other infection to the patient, and then we can freeze those units for the hospitals that are doing the trial. So it can be frozen up to a year, as far as I'm aware.
So Dr. Hilton, in terms of then, you said you can divide one a donation into 3 doses. So are you aware of how many doses will be needed in order to at least see any kind of response or from the patient that it's being used on?
Yes, so different countries have tried different dosing regimens and at different times. The patient protocol hasn't, for South Africa, I must just confirm what they've decided. But as far as I was aware, it was just going to be a single dose, but that will need to be confirmed. Various countries have tried different things with a variety of results.
And is this on a voluntary basis, or is there any kind of cost to the patients?
No, this is completely voluntary. So the person donating the plasma will sign informed consent and be explained exactly what will happen, the risks and benefits. And also, they won't be compensated in any way. Mm-hmm. But similarly, the patient would not have to pay for these units. The costs are being fully covered by the blood services.
Mm-hmm. Right, Dr. Caroline, so when will this be rolled out?
Well, we're getting geared up and we're hoping to start as early as next week. We have one donor lined up. We're just waiting for a few needles and tubes and equipment that we need to get. But as far as I'm aware, the South African National Blood Service and the other provinces, I think they may have started this week. Mm-hmm. So it's not far away from starting.
Right, Dr. Caroline Hilton, thank you so much for joining us this afternoon on the agenda on Radio 786. She's a transfusion medical specialist at the Western Cape Blood Service. They, along with the South African National Blood Service, is calling on recovered COVID-19 infected patients to donate their plasma. So completely on a voluntary basis for the patient and the donor as well. And it's basically to see whether, because these tests have been taking place internationally as well, to see whether using convalescent plasma of people that had recovered from COVID-19 will assist in fighting the virus for those who are still dealing with that disease.